When most people think about kidney disease, they think about it the way they think about most serious health conditions. They assume they will know when something is wrong. They assume there will be obvious, unmistakable symptoms that will send them to a doctor before significant damage has occurred. They assume their body will give them clear, early warning before the problem becomes dangerous. For kidney disease, that assumption is one of the most medically costly mistakes a person can make. And if you were born before 1955, it is a mistake that could cost you dearly. The kidneys are sometimes called the silent organs, and they have earned that name. The National Kidney Foundation reports that approximately 90% of people with chronic kidney disease do not know they have it, not because they are not paying attention, because the kidneys, even when functioning at 30 or 40% of their normal capacity, do not produce pain or obvious symptoms that most people would immediately recognize as a kidney warning. By the time symptoms become unmistakable, the damage is often severe and in many cases irreversible. For people born before 1955, the stakes are significantly higher than for the general population. Age is one of the most powerful risk factors for kidney disease, and here is why. Over the course of a long life, the kidneys accumulate wear. The tiny filtering units inside each kidney, called nephrons, of which you have approximately 1 million per kidney at birth, gradually decline in number with age. By the age of 70, most people have lost between 30 and 40% of their original nephron population simply through the process of aging. This means the kidney reserve available to compensate for additional damage from high blood pressure, diabetes, medication effects, or other causes is significantly reduced in older adults compared to younger ones. High blood pressure and type 2 diabetes, both of which become dramatically more prevalent after the age of 65, are the two leading causes of kidney failure in adults. If you were born before 1955 and have either of these conditions or both, your kidneys are working against a significantly more challenging set of circumstances than the average person's kidneys, and the signs described in this video deserve your immediate and serious attention. Before we begin the list, please subscribe and turn on notifications so you never miss health content created specifically for people in your age group who need this information most. Now let us go through all 12 kidney warning signs that people born before 1955 especially need to watch for. Sign number 12, changes in your urination frequency, color, or appearance. Your urine is one of the most direct windows into your kidney health available without any medical testing, and changes in its characteristics are among the earliest signals that something is changing in the way your kidneys are functioning. Healthy kidneys produce urine that is pale to medium yellow, clear rather than cloudy, and produced in normal volumes across the day, with perhaps one nighttime visit to the bathroom for most older adults. Significant deviations from this pattern warrant attention. Foamy or bubbly urine that persists rather than quickly dissipating is one of the most specific early signs of kidney trouble. The foam is produced by protein, specifically albumin, leaking from the kidney's filtering membranes into the urine. In a healthy kidney, the filtration system prevents virtually all protein from passing into the urine. When those filtering membranes are damaged, protein escapes into the urine and produces the characteristic foam. This condition is called proteinuria, and even in its early mild stages, it indicates filtration membrane damage that warrants medical evaluation. Urine that appears unusually dark brown or tea-colored can indicate that old blood or certain breakdown products from muscle tissue, called myoglobin, are present. Pinkish or reddish urine, when it is not explained by something you have eaten, such as beets, can indicate blood in the urine, which doctors call hematuria. Even microscopic amounts of blood in the urine, which you cannot see with the naked eye but which a urine test can detect, can be the earliest sign of kidney inflammation, kidney stones, or in some cases, kidney tumors. Cloudy urine typically indicates the presence of white blood cells, which are a marker of infection or inflammation in the urinary tract, including the kidneys. A kidney infection, called pyelonephritis, is a serious condition in older adults that can cause rapid deterioration of kidney function if not treated promptly. Producing significantly more urine than usual, particularly in the absence of drinking more fluids, can paradoxically indicate kidney dysfunction. When the kidneys lose their ability to concentrate urine properly, they pass large volumes of dilute urine rather than efficiently removing waste in a smaller, more concentrated amount. Producing significantly less urine than usual is an even more urgent sign, as acute reduction in urine output can indicate a serious acute kidney problem requiring immediate attention. If you have noticed any of these changes in your urine, do not dismiss them as trivial. Have a urine test done. It is inexpensive, non-invasive, and can reveal important information about your kidney health that no other simple test provides. Sign number 11, swelling in your ankles, feet, legs, or around your eyes. Swelling in the lower extremities is common in older adults and has multiple possible causes, which is part of why swelling from kidney disease is so often attributed to something else, such as varicose veins, prolonged sitting, or heart problems, and goes uninvestigated from a kidney perspective. Here is the kidney connection. One of the critical functions of the kidneys is regulating the balance of sodium and fluid in the body. Healthy kidneys continuously adjust how much sodium and water are retained or excreted based on the body's needs. When kidney function declines, this regulatory capacity is impaired, and sodium and fluid begin to accumulate in the body's tissues rather than being properly excreted. This accumulation of fluid in the tissues is called edema, and in the lower extremities, where gravity pulls fluid downward, it manifests as swelling in the ankles, feet, and lower legs. Kidney-related edema tends to be bilateral, meaning it affects both legs rather than just one, which distinguishes it from swelling caused by a localized circulatory problem. It also tends to pit, meaning that when you press a finger into the swollen area and release it, the indentation persists for several seconds rather than immediately filling back in. This pitting edema is characteristic of fluid accumulation in the tissues. Facial puffiness, particularly around the eyes, and especially noticeable first thing in the morning before the fluid redistributes with upright posture during the day, is a particularly specific kidney edema sign. This morning facial puffiness occurs because protein leaking from the kidneys into the urine reduces the blood's ability to hold fluid within the blood vessels, and that fluid instead seeps into surrounding tissues overnight. If you experience persistent bilateral ankle and leg swelling combined with morning facial puffiness, these two signs together point specifically toward kidney dysfunction and warrant prompt medical evaluation, including blood and urine tests for kidney function. Sign number 10, persistent fatigue and weakness that does not improve with rest. The kidneys produce a hormone called erythropoietin, which signals the bone marrow to produce red blood cells. Red blood cells carry oxygen from the lungs to every tissue in the body, including muscles and the brain. When kidney function declines significantly, the production of erythropoietin falls, the bone marrow receives a weaker signal, and red blood cell production decreases. The result is a form of anemia specifically caused by kidney disease that produces profound fatigue, weakness, pallor, and reduced exercise tolerance. Unlike iron deficiency anemia or anemia from poor nutrition, which can be addressed relatively straightforwardly, the anemia of kidney disease is caused by a functional deficit in a hormone that the kidneys are no longer producing in adequate amounts. It does not respond to iron supplements or dietary changes alone. It requires the underlying kidney function problem to be addressed. For people born before 1955, fatigue is so common and has so many potential explanations, including normal aging, poor sleep, cardiovascular conditions, thyroid issues, and medication effects, that the kidney connection is almost never the first thing considered. But if you are experiencing fatigue that is significantly worse than it was a year or two ago, that is accompanied by other signs on this list, or that is associated with pallor or shortness of breath with mild exertion, kidney function should be on the list of things evaluated. The fatigue of kidney disease also has a toxic component. As the kidneys lose their ability to filter waste products from the blood, those waste products accumulate to levels that impair cellular function throughout the body. This uremic toxicity, as doctors call it in its severe form, begins producing subtle effects long before it reaches dangerous concentrations, including a generalized feeling of being unwell, mental fogginess, reduced physical capacity, and a fatigue that has a different quality from ordinary tiredness. Sign number 9, persistent itching all over your body with no obvious skin cause. Itching that is generalized, meaning it affects the whole body or large areas of it rather than a specific patch of skin that has no obvious skin rash or irritant to explain it, and that particularly tends to be worse at night, is one of the more distinctive kidney signs and one of the most commonly overlooked. The mechanism involves the accumulation of phosphorus in the blood as kidney function declines. Healthy kidneys efficiently filter excess phosphorus from the blood. When filtering capacity decreases, phosphorus levels in the blood rise. High phosphorus levels cause calcium phosphate deposits to form in the skin and other soft tissues, and these deposits produce intense itching that no amount of moisturizing or anti-itch cream can resolve. Because the source of the itch is not a skin problem, it is a blood chemistry problem. This type of itching, which doctors call uremic pruritus, is typically described as deep rather than superficial. It is not the kind of itch that satisfies with scratching. It is a pervasive, insistent sensation that is different from normal skin itching, and people who have experienced both often describe kidney-related itching as having a different, harder-to-locate quality. If you have been experiencing generalized itching that is not explained by dry skin, an allergy, a medication reaction, or a visible skin condition, and especially if it is accompanied by other signs on this list, this is a symptom to bring specifically to your doctor's attention along with a request for kidney function testing. Sign number 8, shortness of breath with activities that previously caused no breathing difficulty. The connection between kidney disease and breathing difficulty involves two separate mechanisms, both of which are relevant for people born before 1955. The first is the anemia described under sign number 10. Red blood cells carry oxygen, and when their number is reduced by kidney disease, the body's tissues receive less oxygen per heartbeat than they should. The cardiovascular system compensates by increasing heart rate and cardiac output, but during physical exertion, when oxygen demand rises, the reduced red blood cell count becomes the limiting factor, and breathing becomes more effortful to meet the increased demand. This is experienced as shortness of breath or rapid fatigue with activities such as climbing stairs, walking briskly, or carrying groceries that previously caused no breathing difficulty. The second mechanism involves fluid accumulation in the lungs. When kidney disease causes the body to retain sodium and water, that fluid does not accumulate only in the ankles and legs. In more advanced cases, fluid can accumulate around the lungs or even within the lung tissue itself, a condition called pulmonary edema. Even mild degrees of pulmonary fluid accumulation significantly impair gas exchange, reducing the efficiency with which oxygen crosses from the lungs into the blood and producing shortness of breath that can be severe, and that tends to be worse when lying flat. If you experience a new onset of shortness of breath with activities that did not previously cause it, particularly if combined with ankle swelling and fatigue, the kidney fluid connection is an important consideration alongside the more commonly considered cardiac and pulmonary explanations. Sign number 7. Sleep problems, including difficulty falling asleep, staying asleep, or restless legs at night. The connection between kidney disease and sleep disturbance is more direct and better documented than most people realize. And for people born before 1955 who are already experiencing the sleep changes that accompany normal aging, kidney-related sleep disruption can be particularly difficult to distinguish from expected age-related changes without specific investigation. When kidney function is impaired, the waste products that accumulate in the blood affect the central nervous system, including the areas of the brain responsible for regulating sleep. Many people with significant kidney dysfunction describe difficulty falling asleep, frequent nighttime awakenings, and a general feeling that sleep is not restorative even when its duration seems adequate. Restless leg syndrome, a neurological condition characterized by an irresistible urge to move the legs, often accompanied by uncomfortable crawling or tingling sensations in the legs, is significantly more common in people with kidney disease than in the general population. Research suggests that the accumulation of uremic toxins may affect the dopamine pathways in the nervous system that restless leg syndrome involves. Sleep apnea is also more common in people with kidney disease, and the relationship appears to be bidirectional. If you have noticed a significant deterioration in your sleep quality, particularly if it is accompanied by uncomfortable sensations in your legs at night, and especially if other kidney signs on this list are also present, this combination warrants a conversation with your doctor about kidney function evaluation. Sign number 6, nausea, vomiting, or loss of appetite. These symptoms, when they occur in the context of kidney disease, are caused by the accumulation of waste products in the blood, particularly urea, which is the primary waste product of protein metabolism. In normal kidney function, urea is continuously filtered from the blood and excreted in urine. When filtration capacity is significantly reduced, urea and other nitrogenous waste products accumulate, a state called uremia. The gastrointestinal tract is particularly sensitive to the effects of uremia. The elevated waste products in the blood alter the environment in the stomach and intestines, producing nausea that tends to be persistent rather than episodic, loss of appetite that can be severe enough to cause significant unintentional weight loss, and in more advanced cases, vomiting. Some people with kidney disease also develop a metallic taste in the mouth or a persistent bad breath smell that others around them notice before the affected person does, both caused by waste products that the kidneys are not removing from the blood being exhaled through the breath or altering the oral environment. For people born before 1955 who may also be on multiple medications for other conditions, drug-related nausea is a reasonable consideration, but persistent nausea that is not related to a specific meal, medication timing, or other identifiable trigger, particularly when accompanied by loss of appetite and other signs on this list, should prompt kidney function evaluation alongside other investigations. Sign number 5, difficulty concentrating, confusion, or feeling mentally foggy. The brain is extraordinarily sensitive to changes in blood chemistry. When the kidneys are not filtering waste products adequately, the composition of the blood changes in ways that directly affect how brain cells function. Elevated levels of certain waste compounds, Imbalances in electrolytes, particularly sodium, potassium, and calcium, and the effects of kidney disease-related anemia on oxygen delivery to brain tissue, all contribute to a state of impaired cognitive function that can range from mild difficulty concentrating to, in severe cases, serious confusion. For people born before 1955, cognitive changes are easily and frequently attributed to normal aging or the early stages of dementia. This is one of the reasons kidney disease remains undiagnosed for so long in older adults. The cognitive symptoms of significant kidney dysfunction genuinely do resemble, in their early stages, the cognitive changes of normal aging, making it difficult for both the affected person and their family to recognize that something specifically and treatable may be wrong. The important distinction to watch for is a change from your baseline. If your mental sharpness has declined noticeably over a period of months, if family members or friends have commented on it, if you are having difficulty with tasks of concentration or memory that you previously handled without difficulty, these changes in the context of other kidney signs on this list suggest the possibility of kidney-related cognitive impairment, which is distinct from and potentially reversible compared to degenerative cognitive conditions. If your kidneys are the cause, improving kidney function through treatment and dietary management can meaningfully improve cognitive clarity. Do not accept progressive cognitive decline as inevitable without first ruling out reversible metabolic causes. Sign number 4, muscle cramps, particularly in your legs at night. Leg cramps at night are common in older adults and have multiple causes, which is why they are so easily explained away without considering the kidney connection. However, for people born before 1955, particularly those who are experiencing other signs on this list, persistent or worsening muscle cramps deserve evaluation from a kidney function perspective. The kidney connection involves electrolyte regulation. Among the most critical functions of the kidneys is maintaining the precise concentrations of electrolytes in the blood, particularly calcium, phosphorus, potassium, and magnesium. These electrolytes are essential for normal muscle and nerve function, including the electrical signals that cause muscles to contract and relax in a coordinated way. When kidney function declines and electrolyte balance is disrupted, muscles become hyperexcitable and prone to sudden painful involuntary contractions, which is what a cramp is. Low calcium levels, called hypocalcemia, which can develop in kidney disease because the kidneys are responsible for activating vitamin D needed for calcium absorption, produce muscle cramps, spasms, and twitching. Elevated phosphorus competing with calcium also disrupts the calcium balance that muscles depend on. Potassium imbalances, which are particularly dangerous in kidney disease because the kidneys are the primary route for potassium excretion, produce abnormalities in muscle and cardiac muscle function that range from cramps and weakness to, in severe cases, life-threatening heart rhythm disturbances. If you are experiencing muscle cramps that seem to be increasing in frequency or intensity, particularly nighttime leg cramps, this should be mentioned to your doctor alongside other symptoms, and electrolyte levels, including calcium, phosphorus, and potassium, should be checked as part of a kidney function evaluation. Sign number 3, your blood pressure has become harder to control, or you have developed high blood pressure for the first time. The relationship between the kidneys and blood pressure is one of the most important and bidirectional relationships in the entire cardiovascular system. High blood pressure damages the kidneys over time, and kidney disease raises blood pressure. This creates a feedback loop that, once established, is self-reinforcing and progressively destructive if not actively managed. The mechanism by which kidney disease raises blood pressure involves the renin-angiotensin-aldosterone system, a hormonal cascade that the kidneys initiate to regulate blood pressure and fluid balance. When the kidneys sense reduced blood flow, whether because of actual low blood pressure or because their own blood supply is compromised by disease, they release a hormone called renin, that ultimately causes blood pressure to rise in an attempt to improve kidney perfusion. When kidney disease disrupts the regulation of this system, blood pressure can rise significantly and become resistant to the medications that previously controlled it. For people born before 1955 who have been on blood pressure medication for years and have their blood pressure reasonably controlled, a sudden change in the pattern, where the same medication doses that previously maintained normal blood pressure are no longer doing so, or where previously stable blood pressure begins trending upward without an obvious lifestyle explanation, is a meaningful signal that kidney function should be evaluated. New-onset high blood pressure in an older adult who has not previously had it is also worth investigating from a kidney angle, particularly if other signs on this list are present. Renovascular hypertension, which is high blood pressure caused by narrowing of the arteries supplying the kidneys, is significantly more common in older adults and specifically responds to treatment of the underlying kidney artery problem rather than simply increasing antihypertensive medication doses. Sign number 2, a persistent metallic taste in your mouth or ammonia-like breath. This sign is somewhat distinctive and specific enough that when it occurs in the context of kidney disease, it provides useful diagnostic information. When the kidneys are not filtering waste products from the blood adequately, certain waste compounds reach concentrations high enough to be excreted through other routes, including the breath and saliva. Urea, which accumulates in the blood when kidney filtration is impaired, can be broken down in the mouth and on the tongue by bacteria that produce ammonia as a byproduct. This produces a characteristic ammonia-like or urine-like smell to the breath that family members often notice before the affected person does. Some people describe it as fishy or like overripe fruit. It is distinct from the odors associated with poor dental hygiene or gum disease, though it can be confused with these. The metallic taste that many people with kidney disease report comes from the altered composition of saliva when waste products are elevated in the blood. The taste is often described as like blood, like old coins, or as a bitter, unpleasant aftertaste that persists regardless of what is eaten or drunk. This metallic taste can significantly reduce appetite as food tastes wrong or unpleasant, which explains why it contributes to the loss of appetite described under sign number 6. If you or someone who is close to you has noticed an unusual odor on your breath that is not explained by anything you have eaten or by dental conditions, or if you have been experiencing a persistent metallic taste that has developed over recent months, this combination is specific enough to kidney dysfunction to warrant prompt medical investigation. Sign number 1, pain in your back or side below your ribs or between your shoulder blades. Kidney pain is not the same as back pain from muscle strain or lumbar spine conditions, though it is commonly mistaken for these. The kidneys are located in the posterior abdomen, tucked against the back muscles just below the bottom of the rib cage on both sides of the spine. When kidney problems cause the kidneys to swell or when there is inflammation of the tissue surrounding them, the pain is felt in this specific location, often described as a deep, dull ache in the flank, which is the area between the lower ribs and the hip on either side of the back. Kidney stone pain is typically more acute and dramatic, often described as one of the most severe pains a person can experience, beginning in the flank and radiating downward toward the groin as the stone moves through the ureter. If you experience sudden, severe pain of this type, medical attention should be sought immediately.